Hi, I am Dr. Sandeep Buratoki. I am interventional neuroradiologist, and today I am going to speak about brain aneurysm and endovascular treatment of the brain aneurysms. Brain aneurysms are balloon-like dilatation of the brain artery, and they represent the weak point in the artery. And under the stress of high blood pressure, these brain aneurysms can rupture and leading to brain hemorrhage. These brain aneurysms, they rupture in the space known as subarachnoid space, and the brain hemorrhage is known as subarachnoid hemorrhage. Subarachnoid hemorrhage is a serious medical condition with a very high mortality rate. About 50% of the patient die, and only about 1/3 of the patient return to their normal activity. So the treatment of this brain aneurysm should be offered as early as possible when it is ruptured. And if this aneurysm is not ruptured, the treatment should be based on risk versus benefit of treating these aneurysms versus not treating this aneurysm. There are two types of treatment. One is surgical and another is non-surgical endovascular technique. Endovascular treatment uses transfemoral catheter angiographic technique similar to the coronary angiogram technique. In this technique, we make a small nick at the groin about 2 to 3 millimeter, and we pass a small catheter tube selectively from the groin artery across the abdomen to the neck to the brain aneurysm, and we catheterize the aneurysm selectively under the X-ray guidance, which is known as roadmap technique. Once the catheter is entered into the aneurysm, small soft coils are placed within the aneurysm, and the aneurysms are tightly packed with these coils so that no more blood enters into the aneurysm. At the end of the procedure, the catheter is removed and the puncture site is sealed by the plug. There are different size and softness of these coils, different configuration of these coils like 3D coil, helical or complex shape to accommodate inside the various shape of this aneurysm. The first coil is often the 3D shape or a complex shape coil that form a basket inside the aneurysmal sac. Thereafter, the smaller coils are placed inside the basket, similar to Russian doll technique. Sometimes these brain aneurysms are wide neck. We say wide neck when it is more than 4 millimeter, or the dome to neck ratio is less than 2. In this wide neck aneurysms, the treatment by the conventional coiling technique could be challenging because these coils may herniate across the neck of this aneurysm to the parent artery. In this case, we inflate the soft balloon across the neck of these aneurysms and the coiling is performed. So this balloon temporarily seals the neck of this aneurysm and prevent the coil herniation inside the arterial lumen. And at the end of the procedure, the balloon catheter and the microcatheter is removed. Another technique for this wide neck aneurysm is stent-assisted coiling. In this technique, we place the stent across the neck of this aneurysm, and then we catheterize the aneurysm through the strut of this stent, and we do the coiling. So this stent, they support the coil mass and allow the dense packing of this aneurysm. This stent creates the artificial border between the aneurysm and the artery, and it acts as a scaffold supporting the coil mass within the aneurysm. These stents also facilitate healing of the aneurysm by promoting the endothelialization of the aneurysmal neck. Most of these stents are made up of nitinol, which is nickel and titanium alloy, and they have excellent thermal shape memory. Once they are deployed inside the body, they resume their original shape, and these stents are very flexible. They track the tortuous vascular anatomy. These nitinol stents are biologically inert to the body and is MR compatible, so there is nothing to worry about it. Recently, the endovascular technique has evolved from the coiling technique to the flow diversion technique. In the flow diversion technique, we use a special stent which has a dense mesh of about 48 or 64 wires which are woven together. This special stent is known as flow diverter, and when this flow diverter device is placed across the aneurysm, it causes immediate flow arrest within the aneurysm and it promotes the thrombosis. Flow diverter is the most recent technique available for the brain aneurysm treatment. Endovascular treatment is always preferred whenever feasible. It is less invasive, the skull is not opened and the brain is not touched.